it was we started with the patient. I did ourselves at St. Michael's Hospital for 2 years at our expense to learn about the patient, to learn about data, to learn about privacy. And we built trust and transparency through publications. Now, for the VC folks in the room, our first major hire, which was a big bet, was we poached the former chief privacy officer at University Health Network to be our first hire. Imagine a pitch saying, I have no idea what the product is. I have no idea how I'm going to make money. What I do know is in an industry that's 19% of most developed countries' GDP, and 90% of patients fall through the cracks, and 80% of that data isn't used to make things better. And we learned this first hire with that patient-first mindset was the chief privacy officer of UHN. We avoided that MVP trap. So we weren't focused on building a product based on a recurring revenue model. What we were focused on is how do we validate and automate and trust the ability to solve the problem of unlocking information within the electronic health record. And then we started to build sustainable business models all around that patient. Because if you're a patient with confirmed heart failure, reduced ejection fraction, not on guideline medical therapy, you're worth some money to Novartis appropriately. But you're also going to go to the hospital and not on proper preventative care, and that costs us as a taxpayer a lot of money. So how do you think differently about patient identification and value-based models tied to doing better health outcomes for patients? So when we sort of think about that model and that playbook around putting patients first, you start with the patient. You understand them. You understand the folks around them, and you understand what are those value drivers in terms of the problem that you are solving in order to build and scale your company. And then you think about what's that clinical adoption going to be like? How are we going to actually get it through that meat grinder in a meaningful way where clinicians trust it? Somebody very senior at one of the world's largest pharmaceutical companies told me, said, Aaron, in healthcare, innovation only moves at the speed of trust. And what we are learning in the early days of AI is the currency of AI, the currency of value is trust, especially in healthcare. And then how do we deal with privacy? Then how do we deal with the legacy IT infrastructure in terms of deploying in environments where we don't have the compute? Build all of that into our thinking as we move down that CAM product and MVP.